Good afternoon, North Dakota, and welcome. Grateful for your presence. It's another beautiful day in North Dakota. We've got a lot of information, a lot of positive information. We appreciate those of you that have been tuning in regularly during this entire pandemic, going back to March. We appreciate your efforts to focus on facts, not fear, and your understanding that we have a dual mission, which is to save lives and livelihoods. And truly, as we enter this summer period in the pandemic, gives us a chance here in North Dakota to reflect some more about how we are all truly in it together with our interconnected humanity, because our own actions, while they may be life-saving and protect our own health, certainly at this period of time, our actions can affect others. And this is particularly important to understand the correlation between what we do individually and what we do collectively, because of COVID-19, as we've talked about at previous conferences, the risk is spread so unevenly, and we'll talk a little bit about that at the opening. Our goal all along has been to protect the most vulnerable among us, and those that are elderly and with underlying health conditions, because if you are elderly with underlying health conditions, COVID-19 is not just a something that is that you don't want to catch. It is something that is actually factually can be quite deadly for people. And we've talked a lot about this, again, in the individual responsibility, which we call the, the North Dakota SMART, which North Dakotans on their individual responsibility have done a great job through this, and whether that's, proper social distancing, good hand hygiene, wearing masks when appropriate. But as we go forward, we've also got a collective responsibility to care for each other, our teammates at work, our family members, the students that we interact with, and the teachers who teach us. And especially as we focus on moving towards more full visitation at our long-term care, where many of our most vulnerable live. It's very important that we're exercising that collective responsibility. And some along the way, people have said, hey, this is really like the flu. But if you have the flu, whatever age you are, you generally know it, because if you have the flu, you feel bad, you've got flu-like symptoms, and you probably are feeling such a way that you would probably choose to stay home versus, try to tough it out or go someplace. But with COVID-19, particularly if you're younger, you can have it, you can be contagious, you can be spreading a deadly virus and not even know it. Yesterday, during our call with the White House Coronavirus Task Force led by Vice President Pence, in addition on that call were Secretary Azar and Seema Verma, who leads CMS, and Dr. Birx, Admiral Gerard, Admiral Polochek, and others. But Dr. Birx was sharing that what we know now that we didn't know 3 months ago is that it's an estimated that somewhere between 50 and 70% of the positives of people under age 30 may have no symptoms or mild symptoms, and mild enough that they may not even feel like that they're have anything that would cause them to not go to work or go out or do whatever. So we have again this deadly disease for people that are elderly with underlying conditions, and you can have it when you're younger and not even know it. Again, this is very different than the flu or other things that have been experienced in the past, and that's why, again, COVID-19 risk really spreads unevenly. When we take a look at the confirmed cases in North Dakota, 58% of the people who've had it are between the ages of 20 to 29, but the deaths with COVID-19, 62% of them are people that are aged 80 or over. And that's why it's important for you to know your status, particularly if you're young and healthy. We appreciate that a lot of younger, healthy people came in the past week to get tested, and particularly if you're planning on having close contact with vulnerable populations, we encourage everyone to continue to take advantage of free testing opportunities as they're available. And of course, if you are symptomatic, see your healthcare provider, and also make sure you get tested. And if you're symptomatic, be sure to self-isolate and stay away from others, particularly those that are vulnerable, until such time that you maybe can confirm that you don't have COVID. As we take a look at risks as a state, we're fortunate that that right now we've got some really good numbers we're going to talk about in a second, and I know that there has been theories since the very beginning, because other flu-like or viruses often have less impact in the summer, but we also know that while we're seeing some declines in the northeastern part of the United States, where we had the most number of cases and the most number of deaths, there is a lot of news from southern states, California, Arizona, Texas, Georgia, Florida, North Carolina, others, where we have some counties within those that are seeing increases. And again, these are in warm weather areas. It was shared yesterday that these counties where the growth is occurring, it's about 110 counties out of the over 3,100 counties in the United States. So about 3% of counties are having some increases. Generally, those are counties that have higher dense populations. We want to get into the numbers a little bit, and since we had our briefing last Tuesday on June 16th, we're going to show some numbers that reflect the week versus the day. And during that time, over the course of the last 7 days, we confirmed another 198 cases over 7 days of COVID-19, but it was out of 22,865 tests that were conducted, and that is a record number of tests in a single week. So again, congratulations to all the people involved in both collecting and processing those tests. That brings the positive test rate for the week down to under 1%, which is the lowest we've had in some time. And again, a great milestone for us. The point now is to keep it there as opposed to have it climb back up, as we've seen other states where it may have come down and then gone back up again. North Dakota remains well positioned and well prepared if we do have a surge because of our testing capability and the low use of hospitalization. But from a testing standpoint, we've now completed 158,526 tests, and we're closing in on 100,000 unique North Dakotans that we've tested. In serial testing, which this is the testing where people get tested repeatedly, particularly in high-risk situations like long-term care workers or other healthcare workers or residents in long-term care. And again, on this slide, the light blue on the top represents the people who had been tested previously at least once and were tested again. The bottom in the gray represents North Dakotans that had not been tested before. So in the past week, 8,765 North Dakotans were newly tested, and close to 14,000 individuals had repeats or serial tests. When we take a look at that next case breakdown with the over the last week, we had 198 new cases, as I shared. 288 were newly recovered, which is why our active confirmed cases went down. And this is the lowest number at 234. That's down from 330 active cases a week ago, and it's the lowest number of active cases since April 16th, so in over 2 months. And when we have fewer number of active cases, even when with record amount of testing, and then we know where those actives are because those actives are isolated, then this is one of the ways that we can contain and slow the spread and help work on our half of what we're doing, which is saving the livelihoods, which is getting our economy fully rolling again. So out of the 3,320 positives, we've seen 3,008 individuals recover, but sadly we've had 78 deaths. This is 4 up from last week when we were here Tuesday. Last Thursday, there was a man in his 60s from Cass County. Fridays, it was a woman in her 90s from Cass County. Sunday, a man in his 60s from Stutzman County. And today, there was a woman in her 40s from Cass County. All of those individuals had underlying health conditions. As was reported earlier this morning, we had a software issue in the electronic lab reporting system, which consolidates a number of the different systems into what the reports where we actually put out the numbers. And so that initially reported this morning 7 positives out of 327 cases. Recently the data has been updated as they've worked to complete this. There's now 11 positives for today out of nearly 1,300 tests or so. And again, a little lighter a number of testing today. These are tests that were processed on Monday, reflecting some of the lighter test collections the day before on Sunday, but that's a 0.85 or less than 9%, so it's still a great low number in terms of percent positives. I want to thank the staff, the IT staff, and those working at the lab that spotted the software issue late last night. They worked till 4 a.m. to resolve it, and as the system catches up today, the final completed updated numbers will be reported out tomorrow for Monday, along with Tuesday's numbers tomorrow. So we'll have the final reconciliation and update. The next topic has to do with contact tracing. And it relates back to testing, because of course when we have a positive, we like to reach out to those individuals and have someone with a public health background talk to that individual and again find out who they might have been in contact with, so we can encourage those individuals to get tested and again help slow the spread of this contagious virus. But again, when we are doing all this testing, some days, as you know, when we've got less than 1% positive, we have thousands of people someday to notify that they're negative, and of course we want to do that with a phone call. We want to do it as quick as we can. This was something that was consuming some of our scarce contact tracing capability, was doing the follow-up calls for people that were negative, and I want to give a special shout out today as we announce a great public-private partnership between the state of North Dakota and Blue Cross Blue Shield of North Dakota. They're going to provide call center services in support of our state's contact tracing efforts. So at no cost to the state, Blue Cross Blue Shield is committed to support calling those who have a negative test, and they'll call up to 1,000 individuals per week over the next couple of months. And so far, Blue Cross Blue Shield North Dakota customer service team members, along with other volunteers, have already notified more than 760 individuals that they had a negative test result. So these are fun calls to make. And they'll be only contacting individuals with negative COVID-19 test results, and we've got strict security measures in place and protocols to ensure that personal health information remains secure. The contact tracers, which are employed through the state, will continue contacting all of those individuals who get a positive result, and the remainder, because on some days we actually have thousands of people to call with negatives. But we're grateful for this added capacity by this public-private partnership, and this will continue to expand our ability to get back to people quickly with this important information, so particularly those that get the negative, so they know that they can go on with their family lives and their work lives. Next topic has to do with a executive order update. Early in our response to COVID-19, I signed Executive Order 2020-07, directing law enforcement and private sector businesses to recognize North Dakota driver's license and motor vehicle registrations that had expired on or after March 1, meaning that once we were in the pandemic, if your driver's license or your motor vehicle registration expired, it was still legal and still effective. Today, I signed Executive Order 2020-36. This continues to direct all law enforcement in the state and private sector businesses to recognize North Dakota driver's license and motor vehicle registrations that expired on or after March 1st, that they're to be recognized as legal until August 31st. This executive order simply adds an end date compared to what we had before, which was open-ended, and it means that on September 1, all North Dakota driver's license and motor vehicle registrations will need to be up to date. Letters have been sent to those customers whose driver's license have expired since March 1 and who have not yet had them had those renewed, and they are notifying them with letters to let them know now to schedule an appointment. And currently, NDDOT is working to address the backlog of over 20,650 license renewals and over 48,000 motor vehicle registrations, all of which expired during the COVID emergency, and those are all covered under this executive order. But again, between those two, it's about 70,000 transactions that need to be completed in the next 10 weeks between now and August 31st, in addition to the regular workload, which would be coming in this summer. But so much work has been completed to help get us in position to close this backlog, and team members at NDDOT are working hard, including they're completing driver's tests on Saturdays, scheduling a special driver test day in Jamestown this Thursday, June 25th. They travel to tribal nations to provide photo IDs for voting purposes, to meet North Dakotans where they are, and to reduce traffic through NDDOT offices. They're utilizing drop boxes and appointments for vehicle title paperwork to reduce traffic through offices, and allowing customers to make appointments for motor vehicle business for the first time. And of course, with this appointment process, this is an opportunity for us to help streamline and reduce wait times, which is our ultimate goal, is to provide great service for North Dakota citizens. Just as a separate reminder, if you remember the topic of Real ID, Real ID was the federal law that passed several years ago that required effectively a designation on your state-issued driver's license to be not just effective for state reasons, but also effective for federal, whether that was entering federal buildings, entering military bases, or flying and getting through a TSA checkpoints. That deadline was this fall. That was extended earlier during the pandemic by the federal government to October 2021. And so why am I mentioning that now, that it's extended to October 2021? If you are a North Dakotan and you're renewing your North Dakota driver's license at this time, whether it's one that expired after March 1st and is still legal through August 31st, or whether it's something that is expiring right now, like in July or August, when you come in to do your driver's license renewal, you have an opportunity to obtain a Real ID during your scheduled appointment, and this will save you a trip next year, and it'll save time and energy for both the state and yourself. And so again, go online, understand the Real ID requirements in terms of what documentation you need to take, and if you come in to do that effort, you can again take care of two tasks with one trip by getting your Real ID at the time you're renewing your North Dakota license. At this time, NDDOT is focused on serving customers with driver's license and motor vehicle tabs that expired between March 1 and August 31st, and they'll continue to schedule appointments based on immediate need. Appointments can be made by calling toll-free 1-855-633-6835 or by going online at dot.nd.gov. And again, some other reminders that DOT has remained open for online and essential services throughout the entire COVID-19 emergency, including infrastructure maintenance, such as road construction. They were doing snow removal in March and doing flood control in April. They expanded online services for driver's license and motor vehicle customers at dot.nd.gov. And as you recall, we talked about those earlier here, but CDL, or commercial driver's license renewals, were added to the online service to provide better services to the trucking industry as well. Other things that NDDOT and their broad responsibilities to help keep North Dakotans safe, both on the road or when they stop. They increased cleaning and sanitation at all DOT facilities, including public rest areas and offices. They pulled forward and advanced all construction projects scheduled for completion in 2020 in an effort to complete this important infrastructure, but also to help make sure that our economy keeps growing and going this summer, given all the subcontractors they work with on roads and bridges. We lifted road restrictions early on state roads and bridges to improve response operations. We launched teleworking for many DOT employees, provided personal and protective gear as needed, and required contractors to implement new measures to reduce COVID impacts in construction. instruction. And again, on March 30th, beginning March 30th, we began accepting appointments for commercial driver's license and H-2A written examinations, road tests. And again, on May 11th, NDTO implemented its Smart Restart effort with prioritized services available by appointment, mail-in, online, and through drop boxes. To give you a sense, also, since the North Dakota Smart Restart was launched just June 11th, so this is just in the last, 12 days, 13,875 driver's test license renewals or duplicate licenses, 127,567 motor vehicle transactions, 79,563 phone calls for services, and 4,171 emails requesting appointments. And so again, appreciate to our citizens and our communities and our employers, thanks for your patience and understanding during the support during this unprecedented time. I hope by sharing some of these numbers, you can see the volumes that the team has been dealing with. Many driver's license services, such as change of address, renewals, replacements, and more, continue to be available online. So first place to check is online at dot.nd.gov. See if you can take care of your transaction there. Motor vehicle services, such as license plates and titling, can also be done by mailing in your paperwork. So again, you don't even have to leave your home. Vehicle renewals can be done online or at a self-service kiosk, or they can be done by mail. So again, if you need to renew your license tabs, you can do that without having to come in or schedule an appointment. And lastly, I'd like to say thank you to our dedicated NDDOT team members for their hard work through COVID-19 as they continue delivering essential services, and even more importantly, as they rapidly adapt to serving North Dakotans in new ways, including lots of ways that allow you to get your transactions done without having to come physically to a state location. And we know, given the rural nature and the distributed nature of where our people live across the state, this is be a great step forward, which we'll continue to move on. Next topic I want to talk about is the North Dakota National Guard. I think everyone knows that the North Dakota National Guard has played a critical role in the COVID-19 response from absolutely the very moment that it began, which is the case in just about every single emergency the state faces, that our Guard is there and ready to go. Guard members have served in a variety of mission-critical capacities, and it's on everything from distributing PPE to gathering data to working in the lab, transporting test samples, and helping with all of the testing we've done around the state. We're incredibly grateful to these service-minded men and women who in many cases have put their personal lives on hold, their personal careers, as they were called up from the private sector to come back and be on active duty during this time, and want to thank them for everything they've done to support their communities in our state, and also want to thank all of their family members who support them, because when one individual serves in the family, the whole family is serving, of course. I want to say again, we would not be where we are today. We would not have risen to be among the top states in the nation in our pandemic response without the incredible team members at the North Dakota National Guard. And they're under great leadership, of course, and today General Dorman is joining us to speak more about the significant impact of all of the Guard team across North Dakota throughout this ongoing COVID response. And again, I want to share with General Dorman my deep gratitude for his leadership, not only of the North Dakota National Guard, but also of his leadership of the North Dakota Department of Emergency Services, which reports up to him, and also his co-leading of the Unified Command since we began this. So again, General Dorman, thank you for being here, and thanks to all the great team members at North Dakota National Guard.
Well, thank you, Governor, and thank you for your leadership on behalf of the 4,100 Army and Air Guardsmen. We truly appreciate your leadership, not only as Governor, but as Commander-in-Chief of the National Guard. I also appreciate the opportunity to talk about some of my favorite people in the world, and that's the men and women that raise their right hand, take an oath to support and defend the Constitution of the United States of America and the Constitution of North Dakota. And these are, as I'll touch on later, I want to share some of their stories, not mine. Nobody graduates from high school and says, I want to be an adjutant general someday. But when they hear what some of our soldiers and airmen do, it might strike a chord with them in ways that they can serve their community, their state, and their nation. The governor touched on the National Guard. One of our mottos is always ready, always there. And whether it's floods, fires, storms, and now pandemics, I think the National Guard has once again shown that we are always ready, always there. We started early on, almost from the beginning. Initially, we brought in a lot of guardsmen to help with things like planning, emergency operations, personnel, our Joint Information Service to help get information out to the media and our citizens, and planning teams. The military is accused of over-planning sometimes, but we have a lot of folks that have a lot of training and planning. We have a lot of folks with a lot of training and gathering information and making it into useful information, not just the news. That came out wrong. But actionable information is what I meant to say. And these are all military acquired skills that we can quickly use to respond in a domestic situation. And I'm always in awe of the level of expertise and capability, curiosity, adaptability that our members have. And some of our members I met for the first time in this pandemic, and I didn't realize that we had wicked smart math guys that could do modeling. That could do other things that I didn't even know existed before the pandemic. But it is really incredible. And like I said, we're on board almost from the outset to today, where we have about 312 guardsmen on supporting a variety of missions. I want to talk a little bit about our CST. We'll talk about the numbers too. But our CST is our civil support team. You've probably seen them in action before. It's a full-time National Guard capability. It's 22 individuals. We have science officers, we have physician assistants, we have guys in moon suits that can go out and take a sample of something you're not sure of what it is, and we have mobile labs that we can then analyze that. And this is all in support of civil authorities in the state of North Dakota. But early on, we know we needed to get some of the right people with the right skills engaged right away. And our civil support team are one of the first on the mission. Our civil support team, I would say, literally wrote the book on drive-through testing. And not just for North Dakota. There's a lot of other states that have contacted us to say, all right, how are you doing that? And to give you some idea of their effort, if you remember way back when we were in Amadon, that seems like a lifetime ago, but we did drive-through testing in Amadon. And those guys planned, they resourced it, they executed it, and we were so proud that we got 80 people through a 5-lane drive-through testing per hour. But because of their curiosity, their desire to always get better, their desire to accomplish the mission, we improved on that, and the next day in Gladstone, we were faster. And we've gone from 80 per hour in Amadon to the drive-through testing we did in Bismarck last week. On a 5-lane drive-through testing event, we could do 200 an hour. And with some of the work we've done with the Department of Health and the lead and the support of NDIT, we continue to work on IT solutions to make that even quicker. But just gives you an idea of the quality of the members of the National Guard, and it's always about getting the mission done. And anything we can do to improve the mission to better serve our citizens, that is something the team is going to get after. The other thing is initiative too. If anybody was at the drive-through testing in Bismarck, you know that we pretty much clogged up 4th Street for a long time. And I mentioned this with the governor one day. It didn't take me or the governor saying, hey, can we generate some options here? There's a lot of people that want to test. But a young lieutenant saw this backup, and he knew he had a team that was set to go to Jamestown the next day, preparing to go do that mission. And he coordinated with his boss and said, hey, I could deploy my team right now to the Capitol, set up 5 more lanes, and we can go from, or 4 more lanes, we can go from 3 lanes to 7 lanes and work off this backlog. And they did that on their own. Nobody had to tell them to do it. They just saw a problem. They had a solution. They generated options, and they got it in place. So, again, just a testament to the quality of the men and women of the North Dakota National Guard. The CST was also instrumental in helping the lab go from 200 tests a day to thousands of tests a day, from setting up the mobile labs, which we've discussed before, are mobile like a mobile home, not like an RV, but they set up the mobile labs, they got the equipment, help with, under Dr. Mason's leadership at the state lab, help get all that set up. Got 7 new pieces of equipment online and operating. At the peak, we had 45 guardsmen that were working at the lab to help us surge from a couple hundred tests a day to several thousand tests a day. And interestingly enough, or interesting, I can't say that word obviously, but a lot of those guardsmen, when they came off orders, came on as temporary state employees with the Department of Health. Again, because they know they were making a difference, helping that lab get up to the capacity it is. And these are people that are internally wired to serve others and make a difference. And again, just a testament to who these great men and women are in the North Dakota National Guard. The governor already mentioned, in addition to the civil support team, we've had a lot of folks that have put their civilian lives on hold to stand up 2 more mobile testing teams. And we've done a number of missions. You know, all total, we've had 547 guardsmen on duty during the pandemic, 49 different mission sets, 248 mobile testing events, 350 courier events, and I'm not good at math, but I took those numbers and looked at the total tests administered in the state of North Dakota, and whether it was testing them or couriering the tests back to the state lab, a guardsman touched 47% of those tests. And when you look at the level of support in the lab, it might be close to 100% of those tests might have had the National Guard involved. In all total, since the start of the pandemic, almost 20,000 total personnel days of National Guard support to the pandemic response. And then the next slide just talks about all the different missions we've performed, deep cleaning and long-term care, working on the testing strategy. You were introduced to Brigadier General Schulte a while back. He was spearheading that for a number of weeks. The modeling efforts, I already told you about our wicked smart math guy that helped the Department of Health with their modeling efforts. Long-term care, just across the board. Our job is to support others, the lead agency, the Department of Health, incident commanders at the local level, and we're, again, I'm extremely proud and humbled to be part of this. I'd like to end with other people's words. Because again, nobody graduates high school and says that adjutant general job looks really cool. I think I'd like to do that someday. But some of what our soldiers and airmen do is pretty cool. And I just want to close with a few quotes here. I feel very lucky to support my home and surrounding community during the response to COVID-19. I've learned so many new things about my profession, about myself and fellow North Dakotans that I wouldn't have otherwise. I feel incredibly fortunate to be making a difference. Private First Class Leah Thompson from the 141st Maneuver Enhancement Brigade. Next one. This is literally what I signed up for. Well, almost. No one could have predicted a worldwide pandemic, but my call to serve came from a personal commitment and sense of duty to help protect the people of North Dakota. And I've been doing a minuscule part of that every day. I am humbled. Sergeant First Class Jeremy Siegel from the 81st CST. Next quote. If you told me this is what I'd be doing on my 21st birthday, I tell you, I wasn't fighting pandemics on my 21st birthday, but if you told me this is what I'd be doing on my 21st birthday, I probably wouldn't have ever believed you, but it makes me feel incredibly proud to be here now. The well-being of the state and the health of North Dakotans is way more important and meaningful. I will remember and cherish this birthday forever. Specialist Logan Bauer of the 816th Military Police. And finally, these rolling hills and smiling faces are my home. I joined the North Dakota National Guard primarily because I wanted to give back to a community that has given so much to me. Though the circumstances may be unfortunate, I am proud to say that I have gotten that opportunity during the response to COVID-19. That was from Staff Sergeant Brian Olson. So those are some of the folks that are serving in your North Dakota National Guard. The other reason I'm here today is to tell you that there are more opportunities for young people to serve in the North Dakota National Guard. We had a teleconference a couple weeks ago at the national level because the Army is way behind its recruiting efforts since the pandemic started. I'm pleased to say that in the North Dakota National Guard, we've had our best recruiting from March to the end of June of 2020 as we've had in the same time period for the previous 6 years. And I think a big reason is the quality of our people, the culture of our organization, and the opportunity to be part of something bigger than yourself and to give back to your community. And our citizens see that every time we call out the National Guard in North Dakota. I'm just incredibly proud again and humbled. When you have record recruiting, when everybody else is having difficulty recruiting, that speaks volumes about who we are as North Dakotans in the North Dakota National Guard. So for your benefit, so you can pursue these opportunities, I just put the numbers up there for our recruiters. And if there's anyone interested, please reach out. I did the math the other day, and even with record recruiting, we could bring in another about 180 young men and women who want to be part of the North Dakota National Guard. And you don't even have to be from North Dakota. So if you're listening in Minnesota, give us a call. So with that, thank you very much, Governor. Is that you? Okay.
Thank you, General Dorman. And I want to reiterate that last point again on the Guard recruiting, because again, having an opportunity, it's an honor to work with and have gotten to know a number of the folks in the North Dakota National Guard, and I know from their experiences that they not only learn important life skills that can help them in the private sector, they make lifelong friends, and as you heard from the quotes, they have an opportunity to do some really purpose-filled service work right here in North Dakota. So thank you to all the members of the North Dakota National Guard and their families for helping us get through this, and we still need you. You're an important role going through this going forward. So again, thanks for what you're doing every day and continue to do as we work through this. Next update is on long-term care, and we have some great progress there. So again, I want to give some shout outs there to the long-term care facilities. We issued guidelines with multiple two gating phases to go through. We have 212 of the eligible 218 facilities. That includes every assisted living, every basic care, and every skilled nursing facility in the state. 212 of the 218 have completed and entered into phase one, which means that for their own internal operations, they can reinstitute communal or group dining with appropriate hygiene and spacing, and they can also resume internal activities, that recreational activities such as bingo or other activities that may go on. There's only 3 facilities left to enter into phase one for the reopening, and 2 of those have yet to meet the gating criteria. The other one is waiting for their testing results. And of course, at all 218 facilities, outdoor visitation has been allowed all along and continues to be allowed. And again, thank you for those folks they're doing outdoor visitation. We have heard some feedback on outdoor visitation that it's in some larger facilities it's taking a long time to make an appointment because demand is high. And again, with the guidelines we've given, we want to encourage facilities to do what they can to accommodate the needs of family members, and whether that's setting up multiple places outside where visitation can occur, or figuring out your staffing requirements so visitation can occur not just 9 to 5 Monday through Friday, but evenings and weekends when family members might be more available. Again, family members, if you're running into challenges doing outdoor visitation, first step is contact the facility. Second step after that is to contact the North Dakota Department of Human Services. We've got a series of ombudsmen that are available to help facilitate you and help you as a family member understand the guidelines that we've issued to help you in your discussions or negotiations with the facilities where your family members may be living. And of course, if you need to have your family member leave for an important event, a wedding or something like this, that has also always been allowed. People are eligible to leave these facilities. There may be facility rules that apply when they return in terms of isolation or when they need to get tested again. But again, you can work that out with your facility, and we're happy to help. Phase 2, 35 facilities have already entered into phase 2, which means, and again, we've completed the second round of testing, and they've got no COVID cases among residents. At phase 2, that's when indoor visitation can occur. So indoor visitation is restarted at 35 facilities in North Dakota, and again, those are among the first in the nation where indoor visitation is reopening up. So congratulations to those organizations. Again, as we said, family members, if you're going to visit, good idea to know your status. So again, if you're young and healthy, there's still a possibility that you are young and healthy, may be an asymptomatic COVID. So again, if you have an opportunity to get tested and know your own status, that's great. If you do go visit, please follow the guidelines from the facility that may include masks and distancing to make sure that we're not re-entering that we reintroduce the deadly COVID virus into any facility, because again, as you're seeing your loved one, we don't want to put anyone in that facility at risk. We have a pilot project which we announced last week, giving an update on that at Augusta Place in Bismarck, because one of the ways that we want to continue to build skill and knowledge is how to avoid the gates would be to have family members tested the same way we're testing long-term care health workers. So on Friday, 51 family members of residents at Augusta Place were tested for COVID-19. That represented about 50% of the families of the residents. As a part of this pilot project, those who had a negative test would be allowed to visit their loved one, and yesterday, Monday, was the first day of visitation, and so 10 family members were able to visit their loved ones. Today there's 12 family members, and Augusta Place is still on track to go into phase 2 later this week. This would allow for visitation inside the facility for all residents without the required COVID testing of the visitor. But again, we appreciate Augusta Place being part of that pilot project, because this could be one way where if we end up again, might be a skill that we need going forward to be able to ensure visitation and protect those residents. We'll continue to work closely, as we have, with the North Dakota Long-Term Care Association, with long-term care facilities, and the Resident Council on reuniting residents and families in a safe and timely manner. We know that this is deeply important to maintain those connections, because this is important to maintain the mental health as well as the physical health. And so again, thanks to all those long-term care facilities, and congrats to those that are the 35 that have already completed and are into phase 2. Next topic is the back on the census topic. This is a very important one. We've talked about it multiple times, and we've made a little progress, but not the kind of progress we need to see, and this is important for everyone to understand what this could mean. The census determines all kinds of things on federal funding, not just next year, but for the next decade. Each resident that is missed in the counting could come at a loss of $19,000 to the state of North Dakota, and this is for highway construction, school lunch programs, special education grants, housing housing assistance, and so much more. So many of the federal programs that touch all of the lives of people in North Dakota are based on our population. As a small population state, it's been more critical than ever that everybody counts, and as we say, you count, so make sure that you get counted. There's a portion of emergency funding that North Dakota receives during this pandemic, for example, that is a result of a census taken 10 years ago. And again, we know that we're undercounting in that sense because our state is much larger than it was 10 years ago. So all the more important for the next decade that people get counted. As of Thursday, June 18th, 61.3% of North Dakota households had responded, and that's unfortunately slightly less than the national average of 61.5. The Census Bureau would have sent to you completed delivery of forms to all households in the state. Those that had P.O. boxes were delayed due to COVID until mid-May or early June to the requirement to hand deliver to the residents. I mean, so again, it would not have come to your P.O. box. They would have delivered it to your physical location. But what this means is we've got nearly 40% of households in North Dakota have not yet responded. Of the 50 states, we're right in the middle of the pack. It's not a place we want to be. We're 25th, but we're behind Minnesota, which is in first place with 71.1% of people responding. South Dakota slightly ahead of us at 62.2, and but we do remain ahead of Montana. Let's keep it that way. But we should have you also say again, just like with federal taxes, this is a non-optional. You may say, gee, I don't feel like filling this thing out because I don't want to share any information with the government. Remember that any information shared with the Census Bureau does not go to any other part of the government. But starting in August, if they haven't heard from you, the Census Bureau will send employees door to door to those households which have not yet responded. And if they can't catch you at home, they'll go to a neighbor and ask about your household. And this is all on federal law. So if you would like to have people not come to your door, then you have an opportunity to go online to my2020census.gov. It can take less than 10 minutes. Some people can get done at 5 minutes. If you don't have access to the internet, but you have access to a phone, you can respond by phone at 844-330-2020. Or if you've got a paper form laying around, pull that out and fill it out and send it in. Your self-response benefits our communities. Households that self-respond tend to be more accurate than those that wait for the Census Bureau to come to the door, and this prevents the undercounting and the loss of finances. And again, of more than 19,000 cities in the United States, North River, North Dakota remains the only community to have reached 100%. And while our statewide average is in the middle of the pack, where the state is 25th, we got 5 communities in the top 25 cities nationwide. As again, North River #1. Frontier is in 15th place at 89.9. Harwood at 89.3. Argosville, one of our old arch rivals from Arthur, 88.8. Way to go, Argosville. And then Riley's Acres, 88.7. Those are all Fargo metro area communities that are in 5 in the top 25 cities in the United States out of 1,900. Let's follow their lead and move North Dakota up the leaderboard on the census count. We applaud all the local complete count committees who are working hard. There's obviously a great complete count committee up there in the north and east of the Fargo metro area doing that nation-leading work. But again, mycensus2020.gov to respond, or by phone on the phone number listed there. But thank you for getting that done. Behavioral health update is the next topic. Disasters, which can be both human or nature or caused by nature, affect people and community in different ways. And as a community or an individual begins to rebuild and recover, it's very common for disaster survivors to have reactions to their experiences. Survivors may show physical or emotional signs of stress after the fact. They may be affected financially. Sadness, grief, and anger are just some of the common emotions that survivors may experience. And reaction to the disaster may occur not only in the people with direct experience, but also those who are indirect directly affected through repeated exposure to media coverage of the incident. With good news is that the survivors are resilient, often recover with no additional assistance. However, some people may need a little extra help in the recovery process. And so again, please don't hesitate to reach out for help or to assist a loved one in finding additional support. One of the things that the First Lady and myself, again, want to continue to keep champion is to remove the shame and stigma of the disease of addiction. But in the same way, we want to remove the shame and stigma associated with mental or behavioral health, because health means both mental health and behavioral health, not just physical health. And issues related such as stress or sort of a post-disaster stress condition could, again, have real effects on your physical health. And so, again, don't be afraid to reach out for help. Again, all of us have gone through a rather traumatic experience, whether it's the experience with the pandemic or the financial crisis that accompanied it. But Project Renew.nd.gov is up and running through this special grant that the state of North Dakota received. Again, it's free and confidential crisis counseling are available. ProjectRenew.nd.gov, or call 701-223-1510, or you just go to the website. If you go out there and you can see examples of emotional, behavioral, physical, and cognitive responses that are common reactions. So if you're feeling stressed or a little out of sorts after coming through this, that might be completely normal. And knowing what to expect in your personal life, your family life, your work, your financial life may help you be a better parent, a better spouse, a better friend, a better neighbor as you work through your own response and recovery. And again, projectrenew.nd.gov, and thank you to our great behavioral health team in North Dakota, which is providing these daily updates. Next, we have an announcement. As you know, each of the last 3 summers, we've held an Innovative Education Summit. And this year will be the same, and it's the 4th annual summit. It'll take place on Tuesday, July 21st. This one will be different because it's going to be virtual. And again, so we've got a new date. If we can pop that one up on the slide. The North Dakota schools experienced disruption to face-to-face learning, but I know that teachers and school districts and educators across our state are responding by embracing this opportunity to improve educational delivery and learning experiences. We have learned so much in the months this spring about what works and what doesn't work when we're doing distance learning. And again, as we strive to get everybody back into school next fall, we don't know what the pandemic may hold ahead of us. And so again, as we continue to want to build out the capability to deliver blended learning or distance learning if need be, and if not statewide by a facility, if there's a outbreak at a facility and kids have to be sent home, we've got more skills that we need to continue to develop. This year's summit will be a live stream event, and it's going to be available for registration. Reserve your spot now at this is a long one, 2020 Innovative Education Summit.eventbrite.com. Again, 2020 Innovative Education Summit.eventbrite.com. This summit will bring together stakeholders across the educational system in North Dakota, including parents, students, social workers, behavioral health professionals, teachers, paraprofessionals, business leaders, city officials, professionals, support staff, and more. It'll include inspiring messages from game-changing local and national leaders in education, in North Dakota-led sessions and conversations about a safe restart to school. And we encourage all stakeholders to join us for the statewide virtual summit and join in the collective cause to adopt our education system to the rapidly evolving world. So whether you're an educational professional helping to shape young minds, a student, if you're a student that's just seeking knowledge, or a parent wanting the best for your children, or a business leader that's invested in the future workforce, we all have an interest in the future of education in North Dakota, an opportunity for us to learn and drive positive change together. It'll be easier than ever to attend. You don't have to drive. You don't have to be at a physical conference. You'll get a chance to just tap in virtually. And we look forward to sharing additional information as the content and keynote lineup is secured. And we invite North Dakotans to secure the date to participate. But we know that, again, in this virtual world, and we're going to have an opportunity to secure some great content and some great speakers speakers. So please join us at this virtual event, again, at 2020 Innovative Education Summit.eventbrite.com. We got a good news section. We know that as 4th of July approaching quickly, we know there are many North Dakotans hoping to finalize their plans for the holiday, and many of those plans often include getting out to one of North Dakota's great state parks. Today, the North Dakota Parks and Recreation announced the group camping sites have reopened across all North Dakota state parks as part of a continued reopening that will also include shelters and rental facilities. Across our 13 state parks, 10 of the state parks have group sites. There's 140 group sites at those state parks. And again, if you want to find out more information or make a reservation about capacity limits and further details, there's a Parks and Rec reservation site, which is travel.parkrecnd.com. That is definitely .com. Check that before this meeting, not .gov. So the Parks and Rec takes you directly there, travel.parkrecnd.com. The beginning this week, the Bismarck office is going to be open again but by appointment to purchase park passes. We encourage you to make an appointment by calling 701-328-5357. Visitors will be asked the North Dakota Smart Restart screening questions before entering the building. But again, if you want to call ahead and get a pass, if you don't, you can purchase park passes online, which is even a better way to go, which is make those reservations by visiting parkrec.nd.gov. We recommend going online first. You can also make reservations online. And of course, you can also drive to a state park and buy a pass at the gate entrance, but sometimes on busy weekends, there's a line, and that's why it's a good idea to buy it ahead of time online. In-person off-highway vehicle safety classes will resume in July, and they'll be conducted under the North Dakota Smart Restart guidelines, course information, and registration forms for in-person physical off-highway vehicle safety classes also at parkrecnd.gov. But again, thanks to everybody at the North Dakota Parks and Rec who work in our parks for getting the parks open for camping earlier this spring and now open for group camping. Hope to see all of you out there enjoying North Dakota's great outdoors. We've got under gratitude, we've got two items. And the first is one I mentioned last week when we talked about Silver Linings Day. Today is Silver Linings Day, June 23rd. The proclamation we signed earlier recognizes today as Silver Linings Day the 16,000 individuals who work in long-term care facilities across North Dakota, taking care of nearly 10,000 North Dakotans who call these facilities home. Join us today in thanking these individuals in the communities in the state which house these facilities. We want to say thank you for your care and compassion that you share with our parents, our grandparents, our family members and friends. Your efforts every day through the COVID-19 emergency earn our deepest gratitude and appreciation, because not only were you providing them care, you were there for them, someone who was able to talk to them and be with them during this time. So you've played an even more important role than ever. You've answered a calling to care for some of the most vulnerable among us, and we know that can be difficult at regular times, and now you've had to do it with the additional threat of a deadly virus within those facilities. And as fellow North Dakotans, we thank you for your professionalism, for your patience with our residents and family members, and thanks for your commitment to the whole health of North Dakotans in your charge. We also want to thank you to the residents and the family members and friends who stayed in connection with their families electronically during this time and who are re-engaging them now with Visitation. We appreciate your patience and understanding and your personal responsibility because North Dakota has had a great track record in keeping COVID-19 largely out of our long-term care facilities relative to other states. And again, that was one of our important goals at the beginning. So let's keep it up as we begin the revisitation. And then on the last gratitude item, more of a personal one, but certainly as it touches the whole state. But as we know from yesterday and on the front page of the Bismarck Tribune today, that we lost an exceptional North Dakotan, Sister Thomas Welder. And while we may have lost her here, we know where she has gone to a a positive spot where I know that she was well received. Sister Thomas was the president of the University of Mary for 31 years. At the time, that may have been a record in the country for tenure of a university president. She guided that university through incredible growth academically and athletically and spiritually. She was most deservingly the 33rd recipient of the Theodore Roosevelt Rough Rider Award, the highest award the state offers to citizens, for her incredible contributions to the university and to her own compassion and servant leadership. North Dakota is so fortunate to have known this Linton-born individual who, and all of us who had a chance to spend time with her. Her wisdom will continue to guide us, and her legacy will live on through us. And as I said yesterday in a statement, I was so fortunate because I had an opportunity in the late 80s and early 90s to work directly with Sister Thomas on the Vision 2000 statewide economic development efforts. And I witnessed firsthand the tremendous power in her quiet and humble and grace-filled leadership style. She embodied all the Rough Rider qualities of reflecting credit and honor upon the state and its citizen. And North Dakota is in a immeasurably better place because of her extraordinary service and leadership. And she leaves behind an amazing legacy. She spread the light of knowledge and of faith across our state, our nation, and our world. And Catherine and I extend our deepest condolences and heartfelt prayers to all the Benedictine sisters and to her family and her friends and the entire University of Mary community. But what an incredible life, and I know that she'll be honored well in the days ahead and remembered forever, including with her portrait right outside this room in the hallway with the Rough Rider Hall of Fame. So again, Sister Thomas, again, thank you for everything you did for the state of North Dakota. It ties right in with our gratitude quote. Dr. Albert Schweitzer said, "Sometimes our light goes out, but is blown again into instant flame by an encounter with another human being. Each of us owes deepest thanks to those who have rekindled this inner light." I'm sure there are literally thousands of students and individuals and business leaders and people who worked at the University of Mary and family members who, when you had contact with Sister Thomas, she blew your light into an instant flame because you could just feel her grace when you were in her presence. And so again, for that, the quote from Dr. Schweitzer, so fitting for Sister Thomas Welder. With that, we say thank you, and our next event is going to be TBD, but we're thinking about it being Wednesday, July 8th at 3:30 p.m. And so until that time, North Dakota, stay North Dakota smart and stay North Dakota healthy. And with that, we'll stand for questions. I'm going to go online first, since I think they were waving their hand wildly online. I just couldn't see them.
Mike Smith, 660KYZ in Williston. When the pandemic began in March, North Dakota was one of the last states to be impacted. I believe you had said that we were a few weeks behind other states. With the rising uptick in a number of other states, are you worried North Dakota could see a dramatic rise in cases soon?
Good question, but answer is no. I feel like that with the increased testing simultaneous with our lower percent positives, I feel like we're in good shape. I think we have to continue to stay vigilant through the summer, because as we have more activities, more people getting together, more weddings, more people in congregant settings, more people getting back and going out to dinner, we do have to pay attention, because there is a correlation between transmissible moments and the rate of transmission. So we have to continue to pay attention. But I feel that we're in very good position right now. I think when we see other states with rising numbers, we have to again be careful. There's a lot of headlines about numbers going up and absolute numbers. Those absolute numbers go up in some cases because there's more testing being done. And so you really have to focus in on that just 110 counties that are seeing an increase in their positivity rate. But as we experienced here, when we got better at contact tracing, our positivity rate went up because we were testing the people who were in close contact with positives, because we were trying to get the positive. We were trying to find the positives and get them isolated. So I think the answer to the question for Mike is no, not worried, but we're cautiously optimistic, and continuing to pay close attention every day to the numbers. Okay, I'm going to go Jacob, then Jeremy.
Going off of that, Governor, the president said at his rally that he wants to bring testing down. Dr. Fauci and other health officials say they should keep testing up. I'm not going to ask you if your data-driven decisions decide whether or not you want to have more testing, but is this divide at the federal level going to affect resource allocation to the state level?
The answer is no. We had a call yesterday with, as I said at the outset, with Vice President Pence, Dr. Birx, Polochek, Gerard, Azar, Seema Verma, the whole team there. Any governor that said, we need more swabs, like the governor of Maine, okay, we're going to get you more swabs. We need more tests, we'll get you more tests. I mean, which has been the same with every call. So the national stockpiles and the caches now are, the goal is to get to 60 to 90 days worth of PPE and capability in every state. And everything that we've heard, everything that we've seen is consistent with the idea that we need to test. And I think Dr. Birx in particular was very articulate about as we head into these summer months, it's really important that we're testing younger people who are either asymptomatic, meaning no symptoms, or mildly symptomatic, because those could become the super spreaders unknowingly. And so that's why, again, testing remains a very key part of this. Jeremy, and then Dave.
You've mentioned in the past that you'd like all the school children in the state to be able to go back in the fall. I'm wondering when your office has a plan to release some of those guidelines for returning students.
Well, we are obviously plenty of discussions going on through DPI, and this week we've got I think actually. On Thursday, we've got a K-12 coordinating council, which again is a newly constituted group that the legislature wisely put together that brings together the educational leaders, the teachers union, the teachers, the DPI, the governor's office, brings all the stakeholders together into one formal group. And when I say that seems like in North Dakota, it's like, well, gee, that's just like a normal thing. Many states, those groups never get in the same room ever. Now we meet regularly. We've got resources in terms of support to help us drive agendas and drive dialogue going forward. And so when that group was created, nobody saw the pandemic coming, but that group is going to be super helpful in helping to pull together all the various stakeholders as we help develop a plan. The other thing we're also watching very closely through the different governors associations is, all the states are working on different plans right now, based on their own situations that they have. But there is a lot of people nationally working on how do we safely get school kids back into school. And so there's, and we've got some time between now and August to do that. So compared to some of the other fire drills we've been running through, this one, it's a big, complex operation, as we talked about. It's an $8 million plus a day operation in North Dakota to be busing and feeding and helping to educate 120,000 school kids, and so there's enormous complexity with a lot of local control, because you got all the school boards, which again, School Board Association also represented on the coordinating council. It's a challenging thing, but I'm confident that by July we'll have things surfacing, and I would think the direction will be a combination of as it was this spring when we were working through the pandemic. It was a set of state guidelines, augmented in some cases by local control, like we did with graduation. So I think we've got a good working relationship. We have a good framework, and we'll look forward to doing that. But again, testing needs to be a part of that. And one of the other things that's really open-ended is how do we make sure that we protect, because there are vulnerable students. There are students that have got they may have been treated for cancer, they may have an immune deficiency, and we've got teachers and staff and cooks and bus drivers that might also fall into this category. So it's not hey, let's just throw a bunch of healthy kids and do herd immunity. We've got there's a real consideration of the vulnerable population that exists, and even if that's only a small percentage, we've got to really be thoughtful about it. And look, and at the same time, we've also got to figure out a way in this context, because everything I've just answered your question is about health. So we have to do health, but at the same time, we also have to figure out how do we do education better. I mean, because our educational system can and needs to be even better and stronger than it is. And we had, again, like we had a great strat review yesterday with the distance education and and I say strat review, I mean, as part of our regular ongoing government getting ready for business, we've restarted all of our strategy reviews, and so we're meeting with the Center for Distance Education and the Career and Technical Education, and there's so many new opportunities to expand career and technical education, again, beyond the physical buildings and do some of that online. So again, this is an opportunity for us to not just rethink. There's a bigger, yes, we need to figure out how to get kids and teachers and staff back into buildings in a safe and healthy way, but we also have to figure out how do we do education better than we've ever done before. And our administration wants to push hard on both of those fronts. The first one's a prerequisite, but the second one, there's an opportunity here in this thing to really focus on how do we move ahead in education compared to other states. I've said before, we have a chance to have the best education system in the country, and boy, now would be the time to figure out how to get that done. Okay, we're going to Dave, and then to Lane, and then to online.
Governor, are you
Online is a new term. We have online and online, so, okay.
Are you confident you have enough contact tracers working right now?
I haven't seen the data today, but as of a couple days ago, I think we had 147 people working. And with this new capacity coming from Blue Cross Blue Shield, I mean, one of the things that, again, when you're doing this for the first time, didn't realize how long it takes to try to reach people with a negative. I mean, if you're making thousands of calls a day and you've got a rule that says, hey, we're just not going to leave a message to someone, we actually want to confirm who they are, and you're trying to make a live-to-live contact. So again, really appreciate Blue Cross Blue Shield stepping in and helping on the calls on the negative side. But I feel we're good. I think at one point we had trained almost 300 people, and so with our active number of cases going down, the active cases going down, then we've got less people that we actually have to trace. So I feel like we're in as good a shape. I mean, we're as good a shape there as anyone. And I would also again say this is an unusual time, because just about everything we get to do now, you get to compare what are the other 49 states doing in real time, and there are other states that have used their coronavirus dollars to sign huge contracts, $40 million with some firm to do contact tracing. And it's like, wow. And we trained up students and team members here, and so we're getting it done well, and we're getting it done in a very cost-effective way. So kudos to everybody that's involved in contact tracing. So shout out to Vern Dawson and that whole crew. Lane, we're on Lane right now.
Governor, when we've had issues with testing machines in previous months and weeks, it seems as though we've still gotten over 1,000 tests completed, yet this time with the software malfunction, we got a little over 300. Can you tell us a little bit more exactly what this software malfunction was and how it affected these machines? Well,
and again, Lane, maybe I wasn't super clear as I was zipping through that, but we actually did. This was, the testing machines all worked. We had I think it was close to 1,800 tests that got completed yesterday. But then between when the tests got completed and when they got entered into the reporting system, that's where the software malfunction was. And I actually, they're doing some more, I'm sorry, it was 1,800 tests, but that included out of jurisdiction, a whole bunch of other stuff. In terms of the numbers that we count for North Dakota, it was about 1,300 tests and 11 positives is what got done yesterday. So it was it was part of the record week, but it was the shortest day of the week, but that was more because it was Monday coming off of a slow Sunday test collection. But the issue is an IT one, not the lab equipment worked great, the lab team worked great. They processed all the tests that came in, those 1,300 with the approximately 1,300 with the 11 positives. But where the data all comes together into the reporting system, there was a batch size issue, and so there was a cache, and it filled up, and it got stuck, and then the thing crashed, and people worked hard all night to try to get the thing going again, and so I appreciate them doing that, but we have to take a look at that. But this is what happens even with IT, just like other physical systems. When you stress them with larger volumes, then you can uncover things that work when you've got low volumes and don't work when you have high volumes. And so I think there'll be some memory caching and other changes they make to make sure this doesn't happen again. But this is when we have situations like this, we get smarter and stronger coming out of it. I wish we could, if it was a world where you could beta test everything, that'd be great. But we're in the middle of a pandemic, so we had to build the stuff and use it without an opportunity to do any of the testing of these systems. But it also reflects the fact that in the lab, we did have a number of systems which are aged that need to be replaced. We've got both in DEQ, where we had a strat review this week, and in the lab system, we've got lab systems that are actually the laboratory information, or the LIM system, are in DOS. And you probably have to be my age to know what that actually means, but that is a ancient operating system from the 1980s. So it's shockingly, we still have some systems that way. So that is also part of the problem, is the age of the systems that we're trying to patch together. But again, I just see that as opportunity. Okay, online.
Dave Kolpak with the AP in Fargo. Are there any business restrictions still in place? And if so, when do you anticipate lifting those or reaching the new normal?
Dave, thanks for listening in. We have on our 5-stage risk assessment, we're in the green, which is the low risk. Blue is the 100% open. We're in green. We would expect that we will stay in green. We'll probably touch base on this as we get into July, but we don't have any of the 11 gating criteria that we had. We don't have any of the counties that are above 9 of the 11 gating count to go to blue, and it's sort of a patchwork when you start working your way back to 8 of the 9, 7 of the 9, and again, with that patchwork can be thrown off because of a few cases in a low population area. So again, we may get to a spot before the end of the summer where the whole state can move in one swoop from green to blue. The primary situations in terms of what would be holding back, and you can find all this under the North Dakota Smart Restart Guidelines, and you can find that on the Commerce website. You can go to ndresponse.gov and find those guidelines, but it has to do with the percentage occupancy indoor at bars and restaurants is one of those factors that is affected between blue and green, and the other is the size of large gathering and events. But again, if you have a large gathering and event, whether it's like we've got some speedways that are around the state that have safely reopened and are doing a great job, but whether it's Red River Valley Speedway and at the fairgrounds in Fargo or up in Grand Forks, those people worked hard. They worked with local public health. They got special approval. They're holding their regular events. They're sitting people at a distance, and they've got quite large attendance at those. So those are all working. I know that Mandan was in communication with Chad Berger, the great stock owner operator nationally for PBR. They're working to get the Mandan Rodeo going, even though the parade is closed. So that's an event that they'll work with Morton County and with Mandan. So there are very few things that are affected, but full seating inside of a bar and restaurant is one of those things. But again, I would say kudos to all of the bar and restaurant owners that have developed new business plans that are including working with cities and their location to add more outdoor seating. Would continue to encourage all the city officials for flexibility on that, whether it's sidewalk or outdoor dining for people that haven't had it in the past. And I know a number of people are reporting that they're doing great takeaway business, and even as last weekend, I heard some restaurants in the state were doing business on Saturday like it was Valentine's Day or some other like huge event. So I mean, I feel like a number of these groups are really back, and hopefully they can just keep doing great business like that through July while we continue to assess whether we go that final step or not. Okay, one more online. And then Dave, did you have one or? Okay.
Sydney Mook with the Grand Forks Herald. What support is North Dakota University System receiving from your office or the State Health Department to ensure campuses are safe this fall as students return?
Well, a couple of things are going on. One is there's the North Dakota University System, the 11 campuses, has their own task force that is working on their own North Dakota Smart Higher Education Restart Plan, and that's led by Dr. Josh Wynn. Dr. Josh Wynn is the VP of Health Services at University of North Dakota, also the Dean of the Med School. So that's what he's doing for part of his job that relates to being Dean of the Med School. The other half of his job, as you know, we announced right here, is half-time he's working on leading the statewide North Dakota health strategy. And in that context, he's in regular contact with our office and the state health officer, Andrew Stahl, Tammy Miller in our office, the chief operating officer. We're all working together, and he's assembled a core steering group of great medical leaders from the two universities, and then we're going to be expanding that as we work on the health strategy. So there's a really tight correction right now between that, and then of course also with the Jay Spieler in the governor's office, myself, and Dr. Hagerott, as in PhD Dr. Hagerott, the Chancellor of the North Dakota University System, again, working close in conjunction with them. We still have, again, in the same vein of K-12, there's a lot of learning nationally of how university systems are opening up, and so we can gain a lot of learning from other organizations. In some cases, the age and potential vulnerability of faculty at universities may even be of more risk because of people that work extended careers in university settings, perhaps for more number of years than they might in K-12. And so we have to be really thoughtful again about bringing back that many students who may be asymptomatic or mildly symptomatic and putting them back with faculty and staff that may represent a vulnerable population. So there'll be plenty of things to think about, and one of the things which is also undetermined is the role of testing. There needs to be some more debates there because, again, as I've said before, when we get say we got 45,000 students, if 10,000 of them are living in dorms, then that would be in a congregate living equivalent to the size of our long-term care. And whenever you've got very active people that could be asymptomatic living in congregate living, that could represent some challenges. And so again, I know that a number of the other universities around the nation are really thinking through their testing strategy and their own campus health strategies. Because again, same thing we talked about in K-12, they got to have a whole new set of issues related to health of students and faculty. At the same time, they've got to figure out how to deliver education and have educational value. And I think, again, we'll see a lot of the blended model. There were significant dollars that were approved. I think it was close to $45 million approved by the Emergency Commission last week as part of the Coronavirus Relief Fund that are going towards higher education to help them with both the health issue, help them with moving more classes online for the blended model, and helping to prepare them for students returning in the fall. So significant investment of the federal stimulus dollars going back into higher ed. Okay, Dave?
I'm just curious, how's the city of Arthur doing in the census?
They're not in the top 25, and I probably should check with my cousins on that, see what's up on that, see if we can get them in there. But if anybody could get to 100, I think we get that done in an hour if we just drove around town. So we should be able to be in the leader. Let me check on that one. Okay, with that, I think we've made it to the end, but thank you for that. Thanks for that question. And again, we appreciate everybody being here. And if you're hung in through all the questions, again, if you're a North Dakotan that's been watching online, thank you for being North Dakota Smart. And thank you for everything you're doing to help save lives and livelihoods. Have a great rest of a beautiful North Dakota day. Take care.